The following program contains mature subject matter not suitable for young viewers and images of an actual surgical procedure that may be graphic and disturbing. Viewer discretion is advised.
We've talked about contouring the face with makeup. That's a huge trend this year. But there's also a surgery that can define your features permanently. Here to talk about it is board-certified plastic surgeon Dr. Sheila Nazarian. And in particular, talking about buccal fat pad removal. Welcome, Doc. Tell us a little bit about this.
Buccal fat pad removal is done for a patient that complains of having that chipmunk cheek look. And it's what we're doing with makeup, with contouring that's so popular these days. People can get that permanently if they're the right candidate with a buccal fat pad removal.
Right, and ideally we're trying to achieve more oval or triangular looking faces. Somebody who has a round face who's very full in the mid face is an ideal. So what is the buccal fat pad? It's something we're all born with. Some people have more than others. This pad sits inside the mouth. No matter how much you diet, exercise, the buccal fat pad doesn't go away. So for somebody who's really cheeky, it's a good procedure.
Yeah.
And in reducing your cheeks, it'll enhance your cheekbones,
Right.
just improve overall face, and then if you add other things with it.
Sometimes, sometimes I do Botox injections for masseter reduction.
Right.
Sometimes they have fullness here and back here. Sometimes we do cheek filler with it. It's nice because it's a 1 centimeter incision. It's on the inside of the mouth. There's no external scars. It's done under local anesthesia. You see here, I did this surgery just yesterday. And basically pull out that little fat pad and we cauterize the base, meaning using this hot needle to close any arteries so there's no bleeding. And you can remove a lot, you can remove a little bit. It basically depends on what the patient wants look-wise. What we have to watch out for is sometimes if you take out all of it as the patient ages, it can give them a little bit of a gaunt look. So I always ask the patient, do you want to look the best you can look right now and deal with the gauntness later, maybe with a fat transfer or with sculpture injections? Or do you want me to just take out half or 3/4? You'll have a more subtle look, but you won't have that problem as you age.
Back in the 90s, Kate Moss, who had that wave face look, and I sort of named the procedure after that, and I got a little heat for it, saying, well, what's going to happen to these people as they age? That's when the whole concept of aging and losing volume was just getting its strength. So you sort of can tell. You ask them, did your parents, as they age, did they get gaunt? And the answer is yes. Then they may not be.
Sometimes, though, the patients will say, you know what, doctor, I totally understand that. Thank you for telling me, but I want to look the best I can look right now.
Yep.
So
How much does something like this cost?
It's about $3,000 to $4,000 in the office under local anesthesia, and it takes about 45
Like a
minutes.
dental procedure.
Well, I can say compared to some of the other procedures we've seen today / surgeries, that looks like a walk in the park.
It's some of the happiest patients. It's something, I've always felt like chipmunk cheeks.
Yeah.
Well, Dr. Nazarian, thank you for sharing.
Thanks
We
for having
appreciate
me.
it.
My pleasure.
Stick around, everyone.